Hi, good afternoon, everyone. We're going to give folks just a few more minutes to log in and we'll be right with you. Good afternoon, everyone. My name is Jennifer McDuffie. I'm the Associate Vice Chancellor within Student Affairs, and I will be your moderator this afternoon. Some quick housekeeping items before we get started. All attendee lines will be muted throughout the call. When we get a question and answer, or when we get to that section, please place your questions in the Q&A function at the bottom of your screen. We will do our best to get to all questions, and we will be prioritizing those from students and family members. As a reminder, today's call will be recorded. The recording will be available on our colorado.edu COVID website. On today's call, we are joined by Dr. Phil DeStefano, our Chancellor here at City of Boulder, Dr. Russell Moore, our Provost and Chief Academic Officer, and Patrick O'Rourke, our Interim Executive Vice Chancellor and Chief Operating Officer. In addition, we're joined by Jeff Zayak, our Executive Director at Boulder County Public Health, as well as Trina Ruland, who is a Boulder County attorney, and last but not least, Sarah Huntley, our Director of Communication Engagement with the City of Boulder. At this time, I'd like to turn it over to Chancellor DeStefano for some opening remarks. Chancellor.
Thank you, Jennifer, and good afternoon to everyone. I'm grateful to be able to speak with you directly to discuss how we arrived at the decisions we reached, where we are currently, and our decision-making process going forward, and most importantly, to take your questions. First, I want you to know that whether you are faculty, staff, student, or parent, I've heard your concerns and I understand your frustrations. Many of you have reached out to me, and I know that we must do better. The moment that we're in is clearly a challenge for our students, for parents, for our faculty and staff, and for the community. We're not where we hoped we would be with containing the virus, but we are adjusting and adapting to changing conditions, and we're prepared to adapt more as the situation might require. But to be very clear, last week was one of the biggest infection points to date. The increase in the number of cases that we saw in our student population would, if not corrected, potentially place the city or county into a stay-at-home status. Given our spike in cases and our responsibility to the health of our students, our faculty, staff, and the broader community, we made the decision to move to online learning for 2 weeks to bend the curve on the infection rate downward. It was a decision that we did not take lightly, but it was one that we felt needed to make. And shortly thereafter, Boulder County Public Health determined that it must issue a public health order. Both CU and Boulder County recognized that the great majority of our 30,000 undergraduate and graduate students have been following the rules, doing what we asked of them, and acting in good faith from the beginning. We recognize that even with this reality, health policies have to be enacted with broad strokes in order to protect the community. And so, as you know, the Boulder County Public Health Department decided to restrict the movements and gatherings of 18 to 22-year-olds so that they don't transmit the disease beyond the campus and into the community. Please note that yesterday, the County Health Department updated its policy, and now students are allowed to gather with one other person. This allows them to help each other, escort each other across campus, and participate in legally required activities. As the governing body that oversees public health for the county, they have the authority to restrict any population, business, or organization. And we work closely with the county, and all of our data funnels through them to these types of decisions. Boulder County Public Health has a mandate to protect the entire community. And if infection among our student population represents a potential threat to the community at large, enact orders to mitigate that threat. We've learned much since the beginning of the semester, and I continue to believe that returning to campus was the right decision. But we know that we needed to take additional actions to address conduct that is contributing to the spread of infection and to provide support for our students who have been impacted by the disease. Our faculty and staff are continuing to work hard to serve our students, and we will continue as a campus to rapidly address the changing needs and those of our faculty and staff as well. We recently stepped up support for students from transportation services for on-campus residents with COVID-19 to greater mental health services and extending the tuition withdrawal deadline. We need to continue to improve the student experience in a very, very challenging time. We've made resources available through our Center for Teaching and Learning to help our faculty improve their remote teaching and better reach their students. We are continuing to use the best science and data we can gather to shape our approach. We're expanding our testing capability all the time, and we're going to continue to adapt for the near and long term, as I mentioned. That gives you a sense of where we are in this moment. I'm grateful for your feedback and engagement throughout the process. I also want you to know we hear you. We will continue to do the best we can, improve every day, do what we need to do, and strive to make the campus and the community as safe as possible. Thank you.
Thank you, Chancellor. At this time, we are going to open it up for questions and answers. If you have a question, please feel free to enter it in the Q&A function at the bottom of your screen. We are prioritizing questions from students and family members, and we do hope to get to as many questions as possible today. So with that, I would like to ask the first question, which is directed at Chancellor and Jeff. This is draining and difficult for my child. Why does the process and rules keep changing?
So let me begin. The process changes because of the number of positive cases that we see within the county. And we have, to make those changes when we see an increase in the number of positive cases. Hopefully, through this 2-week period, those numbers will go down. Those numbers of positive cases will go down. And that's when we can make another change, hopefully, for the better. Jeff?
Thanks, Chancellor, and thanks for the question. That's exactly right. We do respond to where our cases are at, and we always prefer to not have to go to an order level. But it's our responsibility to make sure that cases don't expand and don't get into the community to a place where it then impacts all of our businesses and it impacts our folks who are at risk, who we know are who are elderly folks. And that can have serious consequences that are long lasting. as well. So we always respond relative to what we're seeing in our data and if the strategies we're putting in place are working or not. And that's why we put the order in place, because we were not seeing cases come down. We are now starting to see cases come down, indicating that the strategies that we are working on are actually having an impact. Thank you.
Thank you for that. The next question, I believe it may be for me, is will you be doing wellness checks for isolated students? And the question, feel free, panelists, if you want to chime in after, but the answer is yes. We work very closely with our medical services team, as well as our case investigators and contact tracers, and each student who is in isolation does get daily outreach. That outreach comes in many forms: email, phone, and texting. The next question, will there be tuition credits for students for spring semester? And Pat, I was hoping you could answer that.
At this point in time, we are not planning for a tuition credit for the spring semester. We continue to be hopeful that we'll be able to move back to instruction over the upcoming weeks, and that we will need to evaluate as we go into the spring semester. But we are committed to a pathway that is going to allow students to be able to continue their progress towards their degrees and be able to receive their academic credits for the instruction in which they're enrolled.
Great, thank you. I had a little hard time hearing that. Did anyone else? Okay, we'll keep going. Chancellor, what do you say to students who accuse the university of bringing them onto campus just to collect their money and then revert to remote learning?
Well, let me say this, Jennifer, that this summer we asked our students about coming back to campus, and a majority of our students wanted to come back to campus. Many of our first-year students who had a difficult time this past year with COVID, being seniors in high school, really wanted to start a college experience. Secondly, many of our returning students were already in Boulder. Many of them already had their leases for the year that they couldn't break. So this is not about money. This is about providing an educational experience for our students who want to be back on campus. And again, we want to do everything that we can during these 2 weeks to make sure that we can go back to in-person instruction for those courses that we had prior to last Wednesday. So this wasn't about money, it was about the college experience. Plus, we invested a considerable amount of money in getting prepared for our students to come back.
Thank you, Chancellor. For the next question, Provost Moore, what process is in place to monitor the professors and the effectiveness of classes?
Yes, so we actually last year stood up a Center for Teaching and Learning that provides resources for all of our faculty to teach in person, flex hybrid, or remotely. So it's our expectation that the quality of all of our pedagogical offerings are of the highest value and they meet the highest standards. And we are providing resources through our technology office, and again, once again, through our Center for Teaching and Learning to provide that assessment and the resources that our faculty need to provide the very best experience for all of our students.
Thank you. Jeff, I have a question for you. My son currently has tested positive for COVID. Does he need to get retested? And if so, can you give details on how and when?
If he's been tested already and he's positive, he needs to follow the guidance that's on our website that talks about the number of days that he would need to remain quarantined at home and until he doesn't have symptoms, and then he can go back to his normal daily routines. And that information's on our website.
Thank you. All right, Trina, I believe this one is for you. Is the order legal and constitutional? How is Longmont School District opening up that CU students are being restricted? Trina, I think you're muted.
Thank you. Under Colorado law, Boulder County Public Health is required and has a duty to mitigate infectious diseases like COVID-19. It also has a duty to restrict gatherings in order to mitigate those diseases. This order is narrowly tailored to the 18 to 22-year-old population, where we have seen a huge surge in cases of COVID-19. And in fact, if you look at it, there's 100 times greater case rate among this population than countywide. So that is why.
The next question, what is CU doing to accommodate students with non-emergency medical supplies or necessary medical appointments? So I believe I can take this one. Students that are experiencing any type of symptoms at this point, I know it's cold and flu season, could come into medical services. We do have availability Monday through Friday. We also have a 24/7 nurse line. We offer telehealth as well as in-person visits, COVID related or non-COVID related. So we continue to see students for a variety of symptoms, and we also have our newly renovated pharmacy that's open, and it can fulfill prescriptions as well as provide over-the-counter assistance. So lots of opportunities for medical support on campus. Provost Moore, CU says they are supporting their students and they hear them, but how does this translate to individual students?
Well, it translates to individual students in a number of ways. A great resource for students would be through our Division of Student Affairs. They have all sorts of support services for our students. And in addition, they have a wide variety of activities, virtual and some in-person activities for our students to participate in. Under the purview of Student Affairs, we also have our mental health services. So we're trying to make sure that that's available to all of our students, both on and off campus. Our faculty, I believe, have risen to the challenge once again, and they're trying to be as accommodating as possible as they can to our students to provide not only for the best academic experience, but to try to provide for them the best college experience that they can, which would include some co-curriculars along the way. So I think in every way, we're trying to improve every day with respect to responding to the needs of our students and the needs of the students' families as well. And I'm not pretending that we do it perfectly today, but you have our commitment that we try to improve every day in being responsive to our students.
Thank you. The next question is, what support as it relates to food are you providing students in isolation? So I'll answer and then defer to the panel if there are any other questions or thoughts. But students in isolation on campus are receiving daily food deliveries, and in those food deliveries, there's a variety of options from breakfast, lunch, dinner, and snacks. There are dietary needs. There are requests that students can fill out a form when they enter isolation. And as someone who delivered some of that food last week, I can tell you that there are a variety of options from edamame and pho soup all the way to breakfast burritos and sandwiches. So a lot of difference comes there. Pat, I believe the next question is for you. When will you announce if classes will be in person again?
So this is a conversation that we're currently approaching with the county. The county's public health order runs through October 8th. Obviously, the most important decisions that we're going to have to be made are about the incidence of the disease and being able to make decisions that are in line with whether or not we're getting effective control. So over the course of the next week, we'll be working with the county in being able to discuss not only the ongoing public health order, but our conditions on campus. And then the county will also be communicating with CDPHE over that period of time. So I'd be looking for the next week and a half or so as being a crucial time for us to be able to make those operational decisions.
Thank you. The next question has a statement included. So I'm proud of all the COVID plans CU has made. But as a parent of a live-in sorority member, these students living in Greek homes should have been tested from day one, just like students in the residential halls. Can CU, City of Boulder, start testing? I believe I can take that and then, or Pat, would you like to share?
Sure. And we really first appreciate the nice thoughts that you gave us about the planning. There were hundreds of people who worked really hard in order to enable us to be able to return to campus. Our initial testing strategy in part was based upon the capacity that we had. We're expanding that capacity all the time, and we were extraordinarily grateful over the course of the last couple of weeks when the Colorado Department of Public Health and Environment gave us additional testing capacity for the Hill, but they also created additional community resources with a drive-up testing facility. That was really valuable. This week, we're going to be in a position where we're further expanding our testing capabilities. We're going to be able to offer at least 500 more tests a day that can be administered to off-campus students. And so what we want to be able to do is bring that capability to that student population, such as the fraternities and the sororities off campus, so that when they are not under the stay-at-home order, that they have additional testing resources that are available for us to be able to do exactly what the questioner asked.
This next question is for Jeff. My son has already been in isolation for having COVID. Why are those kids not allowed to gather together? Can they not be identified somehow? Also, why are they not allowed to be outside with their roommates? So a multi-part question.
So with isolation, it's extremely important that people isolate themselves because we don't want that disease to spread anywhere else. And for us to try to track and make sure that people who are isolated stay together is really difficult. People are at different stages. So isolation is really intended to stop the spread of that disease. And it is an effective tool that's been proven for years on many diseases. And it's a really important tool that we follow to make sure that that disease does not spread.
Thank you. Pat, the question is for you. I would like to know if CU was consulted on Boulder County's 2020-07 public health order and or the recent update. And if so or not, what would CU like to see changed about the order?
So the short answer is yes, we were consulted about the order. Ultimately, it's Boulder County Public Health's authority to be able to issue the order, but I'm happy that Boulder County Public Health and Jeff, as the executive director, have been willing to consult with us and be able to understand what the educational environment is. That being said, it's not our place to be able to say what should or shouldn't be in a public health order because they have a mandate to be able to protect the entire community. As we go forward and we're going to have additional discussions with Boulder County Public Health, we want to make sure that we understand what their needs are to be able to prevent the spread of community infection. And we want to talk about what we can do in order to create the environment that helps our students to have the best educational experience, but that also is protective of the community. And so that's really where we're going to try to align in our conversations, because we don't want to have a situation that happens in a few weeks where if Boulder County Public Health says this is the order that we need to extend, amend, modify, that we then end up in a situation where we get another spike and it's going to then put us back in the same place. So what we have to do is work on this together in order to be able to make sure that we're seeing those things that are going to result in long-term reduction of the disease burden.
Thank you. Provost Moore, my son attends CU Boulder. Why can't in-person classes resume since no cases have come from in-person classes?
That's a very good question, and thank you for that. Part of the reason that we're doing this is through an abundance of caution. And while there have been no documented cases that we know of transmission in our classrooms, we also know that it's critical that we limit the movement of people in this high-risk age group, both on and off campus. So we believe that it would be much more effective to work with our county partners in execution of our strategies if we took that 2-week pause. Other universities have taken this measure, some quite successfully. So that was our first step going into our voluntary quarantine and moving to remote teaching. So the questioner is correct. There haven't been documented incidents of transmissions within the classroom, but it's also about limiting the movement of student populations on and off campus.
Thank you. This question is for Jeff. I'm unclear on the exact dates of the 2 weeks. Can you please confirm these?
I'm going to ask Trina, who's our attorney on the line, to confirm that.
The order, I assume that this person is referring to the order dates. The order is in effect through October 8th at, I believe, noon.
Thank you, Trina. Let's look here. So Jeff, we'll go back to you. I have a freshman living off or near campus. He would like to be included in free, quick COVID on-campus testing like those in the residence halls. Why, how could this group be more included? Maybe you and I can take that.
Yeah, do you want to start and I can talk about the off-campus testing?
Perfect. So our own campus testing, which I know Provost Moore will speak about or Pat will speak about momentarily, is available right now in a limited capacity for our off-campus students. And so we are looking at ways to scale that and increase capacity for our off-campus students. And right now we also have options that are available in the community at testing sites that Jeff can speak on.
We do have 2 off-campus community testing sites. One is located on the Hill area right near campus, and that is the site that we've really encouraged students to go to get tested. That's for a couple reasons, because it's close access and we don't want people to take public transportation and potentially spread the disease if they are positive. There's ample information on our website about the hours of the test sites. We'll continue to provide updated information as any of those hours change, but I would encourage students to go there. The second testing site location is at Stasio Ball Fields in the City of Boulder. Both of those are free and available to students to get tested.
The only thing I would add, Jennifer, is that by Friday, we should have that additional testing capability up and running so that we'll have testing. I believe they're going to locate that at the UMC. But even right now, we've been making the testing available to off-campus students who come by and request it, so that at Wardenburg Health Center, if you believe, or the other testing sites on campus, if an off-campus student is interested in test, that's available to them.
Pat, thank you. One of the questions we have for Chancellor DeStefano is what options are available to out-of-state students who wish to continue their education at CU, however, they're struggling with confinement restrictions?
Well, what I would suggest right now is that with our out-of-state students, as our governor said, and as other health officials across the country have said that it's best if students stayed on campus and not to go home because of the risk of infection in traveling and going back to their home states and their home cities. What I would recommend is that our students reach out through, if they're living in a residence hall, through their resident advisors to really get some help through our mental health services. We've expanded mental health services. Jennifer, as you know, and you can maybe add to this, we've been very successful with our telehealth from the standpoint of being able to work with our students who we can't see in person. So I would reach out to our counselors, our mental health providers, and make sure that obviously individuals are staying healthy physically, but also staying healthy mentally. And Jennifer, maybe you can add to where students can get those contacts.
Absolutely. Thank you, Chancellor. We have walk-in or drop-in virtual hours every day in our counseling and psychiatric services, as well as our Office of Victim Assistance. No appointment is needed. We also offer individual appointments, groups, as well as workshops and other one-on-one crisis work. You can go to the colorado.edu COVID-19 site, and there's a lot of mental health resources right there, or students can call 303-492-2277 24 hours a day. Along that same topic, Provost, more or similar topic, the question is directed at you. The uncertainty is posing an enormous problem for students, particularly freshmen, making it hard for them to focus on their academics. What are professors and other advisors doing to help support students?
Well, I do know a number of professors and advisors are reaching out to students to provide more virtual office hours. I also know that they're trying to provide significant accommodations to students in the classes to try to be mindful of the very disruptive situation that the students find themselves in. It's been challenging for all of us, and in particular, we're very mindful and sensitive to the health and well-being of our students. And to your earlier answer, Jennifer, one of the things that we've tried to provide broadly to all of our faculty and advisors is links to students of concern. So if a student needs help, we can direct them to the appropriate entity in student affairs to provide the specific type of outreach that we need for all of our students. And I would encourage everyone to be familiar with that, particularly in our student and parent population.
Thank you. We'll turn this next question to Pat and then possibly Sarah Huntley. Will CU and the city plan on enforcing this more rigorously after the ban on two-person gatherings is over?
We're committed to being able to promote good public health practice. If the city changes the public health order so that something is not a violation of the public health order, we wouldn't be prosecuting conduct that does not violate the order. However, our expectation for students will continue to be that they will not engage in the type of gatherings that have been identified as being harmful to the community, and that people who are either hosting parties or violating isolation and quarantine expectations or otherwise engaging in behaviors that are placing the community at risk, that is something that we will need to address through our student conduct processes.
Sarah, would you like to add?
Sure. Good afternoon. I'm Sarah Huntley, the Director of Communications and Engagement for the city. So our police officers look to public health orders as an additional enforcement tool when needed, but we really are leaning into education as much as possible. We don't want to criminalize student behavior. We want to educate people to change their behavior to make sure that we're keeping our community safe. So yes, we are enforcing now, and yes, we will enforce to some extent if there is not a public health order, but we really want to work with our partners to make sure that community members in the CU community know what's expected of them. We've also heard from students that really the best leverage is the leverage that the university can apply in terms of participation in campus activities, participation in classes, and continued enrollment in the city. In the university. So we do refer names to the Code of Conduct review process, and we will continue to do that.
Thank you. Jeff, I'm going to turn it back to you with a multi-part question. The question is, the first question of the multi-part, why is the number of positive cases such a driving number? Are you aware of any CU students dying or being admitted to the ICU because of COVID? And lastly, what numbers will be used to determine further action by CU or the health department?
Thanks, Jennifer. Let's see if I can tackle all those. The positive cases are the driving numbers because it tells us what's actually happening in the community. And those numbers are really important because if we see increased positive cases, we know it drives up our incidence rate, and then there is more likelihood of spread from that population to other populations. What is really important for folks on the phone to know is that for every case that's positive, it's about a 2-hour investigation. And for every case that's positive, there's an average of 4 to 5 contacts per case. And those 4 to 5 contacts take up to 30 minutes or more to do a contact investigation. So when you start to look at the numbers of cases that we see from this spread, you can pretty quickly see how much that adds up in terms of resources and our ability to control it. If we can't control the spread, it can move to the community and it can have significant impacts. And just to highlight a couple of those, so the state of Colorado has put out what's called the dial, and their measures that are associated with, depending on what level of spread you have in your community, what kind of restrictions have to go into place. We are currently at safer level 2, where if we were judged today based on the numbers that we have, it would be at stay at home. So what that means is that we would have to be going from places where businesses are currently open to places where businesses are completely closed. And that kind of impact has significant impacts on our communities. It has significant social and behavioral health impacts in our community. And we do not want that to get to that point. We've lost control of a virus if we have to end up in that point. And it's why tracking those cases, making sure we have good contact tracing and investigation, and stopping the spread, stopping the gatherings, the things that we know are spreading the disease are critically important as we move forward. I hope I touched on all of those. If I didn't, let me know.
I think you did a great job. Is there anything that you could speak to on hospitalizations?
Thank you. I'm aware of one hospitalization at this point, and that was last week. So I apologize that I haven't asked about that data most recently. Our hospitalizations are fairly stable in Boulder County right now, so we're not seeing a huge increase in hospitalizations, and we haven't generally seen a huge increase in hospitalizations associated with this age group that is most prevalent right now in terms of cases.
Thank you. I'm going to direct this next question at Jeff or Trina as it relates to our current conversation. As a mother of a freshman son who is following guidelines but would like the city order lifted for obvious reasons, how likely do you think it is that the order will be lifted on October 7th?
So I'm happy to take a shot at that. So what we will look at in order to determine if the order can be lifted or not is have our case rates come down to a level that is where we currently are right now. So as an example, I'd mentioned we were at safer level 2 when we started in the outbreak. That has been consistent in terms of where our numbers have been across the summer. And when we went into this increase, our goal was to get those numbers back down to there. That's not our overall long-term goal in Boulder County, is to get lower than that, but we need to at least get back to where we were before, so we don't move to another level on the dial, which then requires us to go through business closures in our community.
Thank you. Chancellor, this question is for you. Once we get past the pandemic, and we will, how is the university planning to make good on the shortfall in delivering on the quality education and college experience our students and families were expecting?
Well, Jennifer, obviously we have a history of providing a quality education to our students, as well as a college experience that our students, when they graduate, our alumni tell us was, one of the best experiences that they could have. I'm a firm believer that when we get through this pandemic, Boulder will be back to where it was, and we'll be able to provide that high quality education by our outstanding faculty, and also that we'll be able to recruit the top students that we've been recruiting over the years. So this is a very difficult, a very challenging time. There's no doubt about it. But we have a history here at the University of Colorado Boulder. We're almost 150 years old, and we've been providing a first-rate quality education to our students with our, as I said, with our outstanding faculty. And of course, having Boulder as a backdrop, the City of Boulder and the state of Colorado. So I'm optimistic that when the pandemic is over, when we have the vaccines, when it's safe to do what we normally do on a college campus, as far as in-person classes, as far as the extracurricular activities that we have on a campus, whether it's in the College of Music or in theater and dance or intercollegiate athletics, we'll get back to all of that. It's just this major bump in the road. It's just not a bump in the road, but it's a major bump in the road that we have to navigate. But I'm confident that we will get through this and come back to the campus that our alumni, our parents, our students remembered.
Thank you. Provost Moore, this next question is for you. Is the cohort plan still in the plan? My son and his friends don't seem to know a lot about it.
Yes, the cohort plan is still in the plan. And this is actually a really good question. There are some semblances of cohorts that exist with most of our students, particularly those who live on campus. Our ability to strictly cohort students isn't what we had hoped it would have been in the summer. That said, we do know that we have been successful in certain isolated circumstances of providing very tight cohorts, and that provides actually a very strong social experience for our students. We continue to plan on providing some semblance of the cohort experience for students, because much of what they want to achieve when they attend college is not only the classroom experience, but the social experience. And we believe that the cohorting options or different variations thereof provide that rich opportunity for students to get to know each other and to, compare notes on how they're coming through this very historic time, hopefully a once in a lifetime event.
Thank you. Pat, if I could direct this next question at you. If in-person classes return, will off-campus students be required to submit weekly COVID tests like those that are required for our own campus students?
So the answer to that question is going to be based around our testing capacity. Right now, we wouldn't have enough capacity to enable all off-campus students to be tested on a weekly basis. I think that probably what our next step would be is to be able to try to identify those off-campus student populations that are at the highest risk and be able to implement testing for them, like we had a suggestion from a parent a little bit earlier related to the fraternity and the sorority houses. We'd probably want to be looking at which populations have the highest degree of vulnerability and implementing testing first there. And then as we continue to add capacity, expand it even further out.
Jeff, I'll direct the next question at you. What has community transmission of COVID in Boulder been since the students have been back in Boulder? Why are 18 and 19-year-olds in high school exempt from the order? And can you speak about the attendance at high school football games for that age group?
So I'm gonna defer to Trina about the question about the high school kids in just a second. But let me talk about what we've seen in the community. So since the students have been back, up until last week, we saw very little increases in any of our other age groups. And starting this week, we are starting to see some increases in other age groups in the county. So, and that's pretty much every single other age group. They're very small changes comparative to the large percent of cases that are made up by the students. But we're obviously watching that data very closely. That increase is also being seen at a statewide level. So it's not just Boulder County that's seeing the subsequent increase in those cases in the other age groups. But it does make us take a pause and make sure that we're paying really close attention to what that data looks like. What we obviously don't want to do is we don't want to expand numbers in that population that's most at risk, especially going into a flu season on top of COVID, when we know that we'll have more hospitalizations due to flu. So we want to make sure that we're minimizing impacts, both on the health impacts of our population that are most at risk, but also on our hospital systems that will have to deal with increased flu as well. And maybe Trina can talk about what we've done specifically relative to the exemption in the order.
Hey, Jennifer, before Trina jumps in on that exemption, can I add one more pitch in on what Jeff is saying, which is one of the things we really need to do is have as good of information as possible that will allow people to be able to identify that community spread. And so any student who is contacted needs to really participate in the contact tracing process. That's the best mechanism that we have to be able to make sure that we have an understanding of what those disease vectors are. And if it's something that is largely contained within the CU community, we need to know that, as well as if there is spread into the community, we need to know that so that they can implement the most effective measures to be able to protect the community. So thank you to those who have done the contact tracing, and anyone who is contacted, please engage in it wholeheartedly, because it's one of our best protective tools.
Thank you, Pat.
Addressing the question about K through 12 students who happen to be 18 or 19, the order does apply to every individual who is between the age of 18 and 22. If you are also participating in K through 12 programming and you happen to be of that age, there are exemptions to allow you to continue to participate in that programming. But social gatherings, which is where we have seen the spread, is still prohibited for all 18 through 22-year-olds.
Thank you, Trina. I think, if I may, just making sure the question was around why we're still allowing high school football games and gatherings. Could you speak on that?
I'll have to defer to Jeff on the why.
Okay.
Yeah, I'm happy to address that. So we are allowing football games, but football games can go forward with masking. There is a masking requirement that in any of the sports that are out there at this point, that if they can't maintain 6 feet of social distancing, that they're required to mask. And I know that is consistent across the metro area. I'm not sure if all other jurisdictions across the state of Colorado are in that same place, but we are here in Boulder County. And that's why those sports are allowed to go forward. Football is obviously the one that has the most close contact. But again, that's why we're requiring masking for participants that play football.
Along the same conversation of football, Chancellor, I think this next question might be best for you. It's my understanding that CU football will resume and players will get daily COVID testing. Why do these students get preferential health treatment when others do not get any testing, like my freshman off-campus son?
So that's a great question, and whoever asked that, thank you. Actually, the Pac-12 and other conferences such as the Big Ten, they've worked with testing companies that are providing the test to the various schools in the conferences. So it's not tests that we're using, but it's tests that we're receiving from the Pac-12 that will allow our student athletes to be tested on a daily basis. That actually helps us, and it frees up the number of students if we had to do that testing ourselves, for example. But this is done through our Pac-12 conference, which then allows us to use the tests that we have, as Pat mentioned, where we can start increasing the number of tests for those students who live off campus, especially in the fraternity and sororities. So this is coming down from, in our case, from the Pac-12, and it's a business decision that the Pac-12 made with a particular testing company.
Thank you, Chancellor. Pat, if you could take this next question. First, it's a statement. I do think the university has done an amazing job trying to manage the pandemic with thousands of college students. However, if the students cannot use the rec center or library all year, will CU offer any kind of reimbursements for this? We are out of state, so the ability for our daughter to use these amenities would be so helpful, even if they were required to sign a liability or consent form.
The answer is that if we made it through this period and people weren't able to use those facilities, we would be considering abatement of the fees that are related to them. That right now, we recognize that's an important part of the experience. The decisions that we're making about access to those facilities are not based on financial considerations. It's really based on the disease mitigation principles. And as soon as we can get to the point where we are having a little bit better handle on the control of the disease, we want to make sure that people have access to those facilities in as safe a way as possible, so that even when people are working out at the rec center, we want to be able to maintain social distancing and do the things that are necessary so that we don't see spread in those facilities. And so far we haven't.
Thank you for sharing that. And I'd like to chime in that certain facilities like the rec center are actually open for reservations or individual support for students. Chancellor, can I direct this next one at you?
Sure.
Thank you for taking the time to host this important call. Your candor is greatly appreciated. If the number of new COVID infections does not abate within the next 2 weeks, within the next 2-week remote learning period, and with the new city order, what would be the next steps that CU would consider?
Well, I think what we would consider, I mean, there are probably many options depending upon where we are on October 7th, October 8th, as we look at the number of cases. And again, this would be a collaborative effort between the university and between the county. But it may be, you know, an additional week, let's say, of continuing doing what we're doing. You know, I can't give exact, you know, exactly what would happen. I think there would be options. Again, you know, I believe that we're on the right track, that we will see some changes. We will see changes in the positivity rates. And then what we have to do is see what those are and then make wise decisions based upon the health and safety of our students. So on a continuum, you know, it could be a little bit longer to, you know, continue remote. But until we see the data, I don't want to speculate on that.
Thank you. Provost Moore, is CU considering the pass-fail grading option for the semester just like you did in March? And are you considering canceling spring break?
Two great questions. So on the former, it's serendipitous. I just had a conversation with the deans this morning on how we use our pass-fail policy. I can tell you what we did since last spring. Normally, a student would have to choose within the end of the 3rd week of the semester whether or not they were going to go pass-fail. We've extended that deadline permanently to the end of the 10th week of the semester. But we are in a conversation with the deans, and hopefully we'll have a recommendation by next week as to whether or not that 10-week deadline will be further extended or whether we'll be making any changes to that. Forgive me, Jennifer, what was the other part of the question? Oh, spring break.
Yes.
Yeah, it's very unlikely we'll do a spring break as we used to know it. Most of our colleague institutions, I certainly all in the Pac-12 with whom I have discussions every week, they are not going to have spring breaks. But other universities, and again, I hope to have a recommendation from the deans next week on whether or not or what shape or form a spring break would take place. Could be we will not have a big week-long spring break. That's just doesn't make any sense for us. Some universities are completely dispensing with it, and other universities are giving a day off here and there in the middle of the week so as not to provide 3-day weekends. That said, we hope to provide clear guidance to our families and our students in the upcoming weeks as to what we're going to be doing with spring break for spring 21.
Thank you. And just to be clear, another question came in related to this. It says, when will there be a decision regarding the spring semester start date? Provost Moore?
I hate to keep telling you it's going to be in a week or two, but it is going to be in a week or two. It's my expectation that it has to be by the middle of October that we're going to need a really hard, fast decision on that. I think in terms of the start and stop dates of the spring semester, those are less important than the structure of the semester. And a lot of that will be dependent on our success in bending the curve with the current public health guidance in partnership with the county. And a lot of that has to do with the experiences that we're having throughout the rest of the fall semester. What I can tell you, and I hope everyone appreciates this, is every day we learn more and more about the disease, and every day we learn more about what strategies are effective with our students. And I would be remiss if I didn't call out the students here to say the vast, vast majority of our students are doing a great job of adhering to the public health guidance. So I just want to give kudos to the students who are obeying the rules and being compliant with public health guidance. I really appreciate it, and I really hate to see all of our students being painted with one brush.
Thank you. Sharina, if I can, I'm going to turn this next one to you. We heard a rumor that students in the 36 addresses in the new order were put on a no-fly list, which may severely affect students' ability to fly at home for Thanksgiving break or when they move out. Is that true?
So first of all, the order is only in effect until October 8th. The order says nothing about a no-fly list, and I'm not aware of one.
And I can jump in on that, and I'm probably going to ask our public information officer, who I was also on the phone, Chana Gassetis, to confirm this. But the only time we would use the no-fly list is if we had somebody positive that we were worried was going to travel, and then we would ask for them to be put on a no-fly list, and maybe Chana can confirm that.
That's correct. The no-fly list is really related to stopping the transmission. So it would really only be if someone was ill or had contact or exposure.
But let's be real clear here, which is that even if students are not on a no-fly list, those students who are in isolation and quarantine, they need to be really adherent to those orders over the next couple of weeks. And that as time goes on, even if people are not under a stay-at-home order or anything else, being mindful about where you travel and how you travel is not only protective of the campus, it's protective of the community. So we're asking people to be mindful of that even during this period of time.
And Jennifer, could I add to that? Because I think this is a really important point, and I want to make sure everybody on the phone really understands this. So because I saw several questions in there related to when exactly would the order be lifted, what would that need to look like? And in order for us to stay at safer level 2, which is where we're currently categorized at, we would have to be at 175 or less per 100,000 in a 2-week incidence. We would also have to be at no greater than 10% positivity rate, and we would have to have stable or declining hospitalizations. So in order for us to get to that, it really is dependent upon the individual behaviors, because we cannot be everywhere all the time. There's no doubt about it. And we absolutely don't want to see students stigmatized. And we know that that's happening now. These are last ditch efforts for us. We don't only make these decisions on our own. So as a public health director, I am required to meet with the state health department, who assesses where I am on that matrix, that dial that I talked about. All this information is online on the state website. And I have to demonstrate to them as well that I have strategies in place that will hold us below having to change. Otherwise, we would have to make impacts, again, to businesses across our entire community that would impact both mental health, behavioral health, substance abuse issues, a whole host of issues relative to childhood and families that would be very detrimental. So I want to really emphasize, again, the importance of taking this seriously and doing everything that we can from a standpoint of making sure we're following these recommendations of not gathering, wearing masks, washing hands, because it's going to come down to that as to how we move forward from here. So just, I want to emphasize that to everybody that's on this phone.
Thank you. And I think that that's a really good transition point as we conclude the call. Thank you all for everyone who called in today. If you have further questions, please visit colorado.edu/COVID-19. We will provide twice a week updates at 10 a.m. on Thursdays with the city and county, as well as weekly Tuesdays at noon. You can also give us feedback by visiting our COVID-19 website. There's chat feature at the bottom. There's a who to contact box at the lower left page, as well as the ask a question. We'll now conclude the call. Thank you for joining and have a good rest of your day.